but definitely you can do good for what you want it to be. Next. So this 4.5 years of MBBS course is divided into 3 divisions. So we call it as preclinical, paraclinical and clinical. So the moment you enter into a medical college for 1 year, you don't have a step with you. So you don't feel that you are a medical student, only you have a white apron, but apron is with everybody now. Most of the, I think second PU itself you have started wearing a white apron. Only happy thing is, yes, you are entering into a medical college, probably you are walking in the corridors of a hospital, but no stethoscope. But you are with learning the normal anatomy, the physiology and the normal biochemical process that occur in the body. So only satisfaction you can boast with your friends probably is that you are dissecting a dead body. Okay, so 1 year you are in preclinical phase. That is divided into 2 terms. There is no semester scheme here. So we call it as terms. So 1 year is first term and second term. So at the end of second term you take up the examination. So exams are only after 1 year of joining MBBS course. So this exam is a must for you to pass or qualify for you to enter into the second year. And passing in first year is very important for you to enter into second year. There is no carryover. By chance you fail in any one of the subjects, so you lose a term, that is 6 months. So you cannot go along with your, okay fine. Next, you cannot go along with your friends. Okay, you lose. This is the period where your 5.5 year course becomes 6 years. Doesn't matter. No, failure is a stepping stone to success because there's a lot of things that probably they do not favor or come in your way of success. So you need to get adjusted to a professional course. It's not just like you see how you had studied. So it doesn't matter even if you next fail in the first year, but the duration increases there. So here there is no choice of subjects. There are 15 subjects a student has to learn, all are compulsory. Next. So I was telling you about the 3 divisions. So we had the first division preclinical, I said 3 subjects. Then second is paraclinical. After 1 year you enter into paraclinical and about 1.5 years you are here in this department. Then you move on to the clinical or the final year, which is again for 2 years. Next. So first year I told you there are 3 subjects and you need to pass all the 3. Next. So second year you take up examination in 4 subjects. So this is the time you just enter into the hospital and you have a step with you. So that satisfies many of the students, who opt for MBBS and who are looking at themselves becoming a doctor. So you are with the patients from second year onwards and you are learning from them. There are 4 subjects for which you need to take examinations. This is after 1.5 years. Next. So final year is phase 3. So this is again divided into part 1, part 2. Part 1 is 6th and 7th term. You take up examination in 3 subjects and then final year you take up examination in 5 subjects. So just look at this. There are MBBS whole course is divided into 3 phases. It's for a duration of 4.5 years. There are 9 terms and 15 subjects which are compulsory for you to read or study or learn. Next. So this is just to talk about the attitude and how you should be if you want to take up this course. All of us go to temples of our choice. But for a doctor, I tell you, consider hospital as a temple. Next. So each of your patients is a god, and your teachers who are there who teach you from deceased, they are the priests, and you're all there learning from your teachers as deities. So that should be your attitude or the way you look at the suffering and patients. Next. So medicine is learned bedside. So read books. Very important is most of the medicine is learned from the patients. So you should be grateful for the patients who give you an opportunity to learn. So learning medicine starts from the first day you're learning food and age only a little grade. So don't think that you're completing MBBS is very happy and you can start practicing. So the last day you practice as a physician or a doctor, so you need to learn, you need to study.
Sound input ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಮಾಡಬಹುದಾ? Sound input ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಮಾಡಬಹುದಾ please?
Next. Next. Previous. See, all these colleges in which you take admission through CET Format K, they come under RGUHs. So that is Davangere University of Health Sciences. This is just to tell you about the pass criteria. You need to get 50% pass. And this is the examination pattern. You have theory, you have oral examination, that is the viva essay, as well as the skills which are being tested either in practicals or clinicals. So 75% you get a distinction. Then first class is for 65% and second class is for less than the 65. I tell you, passing an examination is very, very easy. So the way the questions are, the question paper is. So it's not intelligence that is required, it's the hard work. So each and every student who puts in hard work can definitely pass the MBBS examination. So the other thing, when you become a PG, lot of other, along with the knowledge, lot of skills are also required. Next. So at the end of 4.5 years, this is the time you all probably, or your parents are wanting to see you as a doctor. You're so happy to write these two precious letters, doctor, in front of you. So the prefix doctors that you get after 4.5 years, but you are not allowed to practice at the end of 4.5 years. Next, you need to undergo 1 year of compulsory rotatory housemanship, where you learn all the skills. You are with the patients for a very long time. Next. So then after 1 year compulsory rotatory housemanship, you need to get your degree registered under Karnataka Medical Council. So you get a registration number, then you are legally allowed to practice. Next. Next. So this is just to tell you this word dossier. If you just look at the little meaning, it means to teach. What I mean to say is a doctor has a lot of responsibility in the society as a teacher too. This teacher doesn't mean that you have to go to a medical college to teach or become a teacher. So many of the students or many people may not like to take up this teaching profession. So that also should be a passion. But you need to teach each and every patient you see. Or you need to teach the community about diseases, prevention, everything. Next. So therefore, every doctor, say I told you, you need to be a role model in the society, be a friend, philosopher and guide to your patients. And as Hippocrates puts it, doctor cures rarely, comforts mostly, but consoles always. So it's not just your specialist degree that counts a lot. So a lot of family, say, work of a family physician and consoling, counseling and comforting is also one of your major responsibility, which probably we do not see much in this modern era. Next. So these are the colleges, I gave you a list of these colleges which come under CET for various systems of medicine. Next. So DAMS, I told you, if you cannot get into MBBS, if you only want to be a doctor, you can choose this course. Bachelor of Ayurvedic Medical Sciences. I told you the number of colleges, they're very good colleges you may choose. Because nowadays you are seeing, the old system of medicine which is gaining a lot of importance. There is postgraduate course also in this. And many of us use lot of Ayurvedic medicines at home. So nowadays people have switched over to the naturopathy and Ayurvedic medicine more than the other medicines which are, of course, many of which are, of course, toxic. Next. 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 So if not Ayurveda, you can really look at choosing or becoming a Bachelor of Homeopathy Medical Sciences. So there are 11 colleges, so you can choose to become this. I tell you how this is important later, because we are not getting duty doctors even in a medical hospital, medical college hospital, in nursing homes, in private hospitals. If you just go and talk to many of the duty doctors who are working, so many of them are Ayurvedic medical graduates. Very hard to get MBBS doctor to work as a duty doctor. So they are joining even our hospitals and learning this allopathic system of medicine. Next. Next. It's just I've given you a list of homeopathy medical colleges which are there. Next. 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 So the other course I told you is about Unani medicine. So BUMS, Bachelor of Unani Medical Sciences. There are 3 colleges under CET cell. Next. So naturopathy and yogic sciences. There are about 11 colleges. So you can take this also as an option if you really want to become or take up your healing process or therapy or become a doctor. Next. Very important is every doctor should be a healer, because most diseases cannot be cured